Hey there, I'm Dr. Beau, and I want to go over a brief overview of the art of assessment, which is the newest course that I'll be teaching. The first one is coming up in Costa Mesa here in a couple weeks, and I just want to give a quick overview for anybody that's curious about this course or on the fence about signing up, and here we go. So the main reason I developed this course was, and if you've heard me say this before, if you've been in this office for sure, that I think if your assessment is on point, all of the treatment becomes a heck of a lot easier. So we can almost have mediocre treatment skills or hands-on skills and get world-class results if we're just a little more accurate. So how do we become more accurate? I think one of the best ways to do that is to pull from other professions that have all of the skills that would make the best diagnostician in the world. So what are those skills that make the best diagnostician in the world? The first one is observational skills. I think we would all know that, but who are the best observers in the world? And again, pulling out from outside of our profession, looking at organizations like the CIA and FBI. I even have a story about a general contractor that I worked with that, just observational skills of what they're looking at. And then how do you, each one of these skills, how do you hone it? So again, looking outside of our profession, what can we do to work on these skills? The next thing, it is a skill, but it's a skill set. So it's a breadth of knowledge and both a depth of knowledge. So the breadth of knowledge, we start day one when we enter, school, graduate school, and that's the basic sciences, these core sciences that set us up for success. And that breadth of knowledge is always growing. But I think one of the mistakes that's happening nowadays is that students and new docs think that they need to just continue to expand their breadth of knowledge by attending seminars, continuing education, continuing to just read, which is good. But if you get too much there's too broad of a scope of information, you're looking out at the ocean and you don't know when to dive deep, how to choose what tool, it doesn't matter. So then we want to work on the depth of skill over time, but maybe we start with a little less breadth, and I'm going to kind of dance around both of those. And then the way you dance around those is the concepts of how we think as humans. There's three main types of thinking, this is the third skill set, is divergent, convergent, and lateral thinking, and how do we jump between those three very effectively and efficiently within the time frames or time constraints that we all have seeing patients. Next one is psychomotor mastery. So a psychomotor skill, right? How are we linking up what our environment is telling us with what we're able to do? Palpation skills, the ability to apply things like an adjustment, soft tissue, whatever that might be, or the palpation skill itself. But what other professions are really the best in the world at that, and then why are they the best? Communication. This one gets talked about all the time. That we know we need to be good communicators. If you're going to be, we all consider ourselves educators within the treatment room. But what makes up a really good communicator? Who are the best communicators in the world? And again, how do we hone those skills? And then the last one is we have to, even though I'm putting this in the skill or main principles of this, it's having some sort of hierarchy. You could call it a system, you could call it a protocol. I like calling it a hierarchy because there are things that we need to be aware of first and foremost. And then as we check those boxes, more or less going through, checklist manifesto of our own, that it makes it easier and easier with each patient encounter to make sure that we're not missing the big stuff, but also that we get directed to the main thing, the linchpin, as fast as we possibly can. And what do we want to do once we have all those objectives in place? Well, we want to put it all together. We want to put it in clinical practice. We want to workshop it, and that's what we're going to be doing is, as best we can in these mock scenarios. And, maybe sometimes we will have patients come in, but But that's, you know, the hardest thing is we can have all those skills, but then you have to somehow create this amalgam, have some sort of alchemy where you are a fantastic world-class clinician. And then the last part of the seminar is just hopefully explaining what a path to clinical mastery looks like over the long term, and step by step what I would, you know, expect somebody to be doing on a daily, weekly, monthly, yearly basis to be on that path. And yeah, I'm really excited about it because I think it's necessary, because we're swimming in knowledge but devoid of application. And hopefully I can help chip away at that barrier a little bit. So I hope to see you at a course coming up soon.